Dr. Oliver Tobin, who has been on our Mayo Clinic staff in Rochester since 2015. He is also interested in autoimmune disease and is an MS and NMO specialist. He's also interested in histiocytic neurologic disease, including Langerhans cell histiocytosis and Erdheim-Chester disorder. And he's going to talk to us today about tumefactive and other inflammatory disorders of the CNS, common tumor mimickers in my experience as well. Thank you.
So I'm going to talk to you about tumefactive brain lesions which aren't tumors. And the majority of these may end up being multiple sclerosis. And it's a really great time to be in the multiple sclerosis field because it's 150 years this year since Charcot described multiple sclerosis in his seminal lecture series in the Salpêtrière. And nothing really happened for quite a long time. He described a progressive disease with ataxia and quite disabled patients. And up to 1993, there were no drugs available for multiple sclerosis. And then in 1993, the first drug came online. It was beta-seron. It was thought it was going to be brilliant. It was so popular that there was actually a lottery to get on the medication because there was not capacity by the company that was producing it to produce enough drug. And since then, there's been an explosion in drugs for multiple sclerosis, but also an explosion in the diagnosis of inflammatory brain disease, as outlined by the previous speakers as well. So that's kind of where we're coming from. It's an exciting time. There's a lot of opportunity for treating these patients. And we're also moved the time of diagnosis from that very late phase that Charcot initially described right to the beginning of the disease. And I think we're approaching a point with demyelination disease where, although we don't have a cure, we have very potent treatments that, if they're given early and given appropriately, that we're essentially approaching where we are with HIV or some forms of cancer, where you can suppress the disease to the point where it's almost like a cure. So that's kind of where we're coming from with this. I don't have any relevant financial disclosures. I may touch briefly on the use of cyclophosphamide and alemtuzumab as off-label medications. So what am I talking about? Well, this is a case of a patient who turned up to clinic in Rochester. He was from the area. He didn't fly in from crazy far away. And he was a 35-year-old man with no previous medical history. He was slightly obese, but nothing else. And he had progressive vision changes when he presented for a few weeks. He turned up to the emergency department, and he was a bit confused when he turned up to the emergency department. And he had this MRI, which you can see is quite abnormal. And he had an EEG because of the confusion, and he had subclinical seizures.